this is Carley. This is Lindsay's dog, and she's anesthetized. And we have her under anesthesia because we're going to clean her teeth. This is an esophageal monitor, a monitor that we're going to put down into her esophagus. I'm going to open her mouth. I'm going to slide it in there. This is going to help monitor her heart rate and her temperature while she's under anesthesia. There's a machine behind Lindsay. She's going to show you that. I'm going to watch, as we watch to see the heart rate pick up. I just have to make sure I get the monitor in just the right spot. The other things that we're monitoring is her pulse, her percentage of oxygen, which is on this little sensor, and her blood pressure, which is on this sensor. And then the machine, now you can hear it picking up on the machine. You can see her little pulse waves right there. The upper wave is the ECG wave. Her heart rate's 144. The percentage of oxygen is 97%. And you can see that kind of S-shaped curve is her percentage of oxygen curve. It's called the pulse ox. The upper two lines are her ECG, electrocardiogram. At the bottom, you can even see her temperature is 96.4, but it's rising. That's a temperature sensor that's inside the esophagus. And then we'll be running her blood pressure here in a little bit. We just have to signal the machine to run that. So, since she's stable, we're going to go ahead and start the dental. And what we're going to do in her case is she has a lot of tartar. Let me get a light here. She has a lot of tartar on these canines. You could probably zoom in on this and see that this portion of her tooth has a lot of brown tartar and calcified areas. You can see this is calcified plaque, tartar, or sometimes we call this calculus on the teeth. Other teeth actually look pretty good. This one's not bad. But back in here we have another little area where there's a lot of buildup. So we're going to clean the teeth, and then we're also going to assess all of her oral health to see if she has any masses in her mouth, any little areas along the gum line that are ulcerated or red. We're going to look under her tongue and in the back of her throat, make sure there's no masses or anything there. We'll flip her over and do both sides, and we'll show you how to clean, and then polish, and then put a dental sealant on the teeth. So first I'm going to start. Actually, first I'm going to start and grab gloves here. The first thing we're going to do is run this Cavitron. It is a high, kind of an ultrasonic scaler. It runs at a high speed with water and vibration, and it helps to kind of vibrate and lift off the calculus. There is. See this little stream? So we come along here. Some of that's on there pretty solid. When it's on there pretty tight like that, we take this thing. It's called a dental extractor. But instead of removing the teeth, all I'm doing is kind of chipping at this calculus to break it loose. And then I'm going to come back in again with the Cavitron. See how that broke loose? It's very hard and like formed on there, calcified on. Now you can see this little Cavitron lifts off whatever debris is there. So we take off the big chunks with the elevator and then work our way across the tooth. You want to move rapidly across the tooth because you don't want heat of the machine to warm the tooth or cause damage to the tooth. You also kind of want to work a little bit up under the gum line. This is called subgingival cleaning. You can see there was a little piece of debris that just came flying out from underneath her gum line. And there we're cleaning around that tooth. We'll do all the sides of the tooth, but we're going to come back as we flip her over to do the underneath. We're going to move to these little teeth. That's, of course, the canine tooth, but this here is the smallest, one of the smallest teeth in the mouth. This is called the first premolar. This is another premolar. There's different ways of numbering teeth. That'll probably be explained later in the presentation. The premolar here, and you can see I'm just kind of working my way over the teeth, and then I definitely go back to that gum line to get underneath that gum line. That's where bacteria gets trapped under there. And if someone does try, or this is another one that I'm going to remove a little bit of that calculus first. Kind of peel that away. and come back through and clean it. But what happens when people try and clean dogs' teeth at home without the benefits of anesthesia is that you get up under this, or you can break off the tartar, which looks great, the tooth looks good, but you've just released all that bacteria that's underneath that tartar into the dog's mouth. And if you would cause bleeding of the gum, then the bacteria can go into the bloodstream and can cause some pretty major problems for dogs. It can cause problems in their heart, their liver, their kidneys, and dogs can go into organ failure after dental and teeth cleanings. I've even seen dogs develop pneumonia after a tooth cleaning that someone tried to do at home. Actually, they tried to do it at a grooming salon. They tried to clean the teeth, and they didn't do it properly. They released all that bacteria into the mouth, and about 5 days later, the dog developed horrible pneumonia. So it needs to be done properly at a veterinarian under supervised anesthesia with veterinary technicians. Today with me I have a technician that's helping me, as well as some support staff, and we're making sure Carley is supported and that the monitor is monitoring how the level of anesthesia she's under, and so far she's doing really well. So as you can see, some of these back in here, there was one that was giving me a little trouble. There was a little tartar here that doesn't seem to want to go away, so sometimes what we'll do is use a hand instrument. We use various little picks and devices to see if that will help us to kind of scrape, little tartar scrapers and devices to get into some of those tight little grooves. Sometimes just a little wiggling, and then it'll seal, it'll be able to lift up off of there. Every once in a while there's a tooth that's kind of stubborn and just has a lot of staining. Her teeth are pretty good. I mean, she's a fairly young dog, so there's not a lot of permanent staining on her teeth. But when a tooth doesn't come clean, after you've tried cleaning, scaling, we definitely try and polish them. But some just simply have permanent stain, just like people's teeth. We don't do whitening in dogs. Okay, so soon here we're going to flip her over. These bottom ones are actually pretty clean. I'm just working my way across these. We'll roll her, and then we'll do her other side, and then soon I will come back on to show you the polishing technique.